In pain disorder, you'll find pain that is severe enough to cause clinically significant distress or impairment in social, occupational, or other important areas of functioning, for which psychological factors are thought to have an important role. These are often not intentionally produced. Psychoanalysts describe pain disorder as a symbolic expression of intrapsychic conflict throughout the body. Patients often suffer from alexithymia, which is the inability to articulate their internal feeling states in words. Therefore, these individuals express their feelings with their bodies. By displacing the problem onto the body, the individual may feel they have a legitimate claim to the fulfillment of their dependency needs. Behaviorally, this can be a means of manipulation and gaining advantage in interpersonal relationships, for instance, to ensure devotion of family members or to stabilize a marriage. This is an example of secondary gain. Biologically, we know that the cerebral cortex can inhibit firing of afferent pain fibers. This mechanism is often impaired in pain disorder. We also know that increased activity of limbic regions occur in response to painful stimuli. Serotonin is most likely the main neurotransmitter in the descending inhibitory pathways and is implicated in this disorder. Endorphins also play a role in central nervous system modulation of pain. Endorphin deficiency correlates with augmentation of incoming sensory stimuli. In this disorder, the pain may be post-traumatic, neuropathic, neurologic, iatrogenic, or musculoskeletal in nature. The important thing to remember is that there must be a psychological factor that's judged to be significantly involved in the pain symptoms. It's interesting to note that major depressive disorder presents in 25 to 50% of these patients, and dysthymic disorder or depressive disorder symptoms occur in 60 to 100%. Symptoms include anergia, anhedonia, decreased libido, insomnia, and irritability. Some believe that chronic pain is almost always a variant of depressive disorder. While acute pain serves as an adaptive mechanism executed to seek help and alert the individual to danger, chronic pain always has a psychological variable at play. In the treatment of pain disorder, it's important to discuss the issue of psychological factors early in treatment. The psychological factors are important in the cause and consequences of both physical and psychogenic pain. Explain how various brain circuits that are involved with emotions, for instance the limbic system, can influence the sensory pain pathways. Analgesic meds do not generally benefit most patients with pain disorder. SSRIs and tricyclic antidepressants are most effective in treating this disorder. Psychodynamic psychotherapy involves developing an empathetic therapeutic alliance and acknowledgement of the reality of pain for the patient. Alternative therapies include biofeedback, hypnosis, and transneuronal stimulation.